Hi everyone, thanks for joining. We're going to get started now. Today we have 30 minutes, and just a reminder, one question, one follow-up. Today we have Dr. Williams and Dr. Huyer here, so I'll turn it over to them for some brief remarks.
Right, good afternoon. I'm pleased today to be joined by Dr. Dirk Huyer, not in his normal role as Chief Coroner, but also in his role as a Vaccine Distribution Task Force member and coordinator of the provincial outbreak response. And I'll give some updates, and then at the end I'll see if Dr. Huyer wants to add any further comments from his perspective. So this is Thursday, so we're seeing how the week has gone and where we're at and where we might be seen as the weekend comes ahead of us. And since last update on Monday, Ontario's reported a total of 11,363 cases of COVID-19. That means we had 3,469 cases on Tuesday, 4,212 cases Wednesday, and today, 3,682 cases. That means our current 7-day average for the COVID-19 cases is 4,176. The interesting thing is that's a decrease from last week's, which was 4,208, so just under a 1% decrease. The provincial cases have increased by 26.4% this past week. That's April 10th to the 16th, to 204 per 100,000 people. And that's a bit of a delay due to the rising numbers. Ontario's reported over 4,000 new cases for 5 of the last 7 days, but we've had 2 days when we're under 4,000, and the number's getting closer to 4,000 rather than being in the mid to upper 4,000s. I'm also sorry to report, in addition, that we have 94 deaths since Monday's update. This includes 40 additional deaths in today's update, which is the most in a single day during the third wave of the pandemic of the province. We extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19, and to all those mourning the death of a loved one in these difficult times. And we've seen these coming from different settings, whereas in the past we saw more coming from long-term care. We're seeing, unfortunately, some can even come from the community side. Hospitalizations and ICU occupancy are once again at their highest levels since the beginning of the pandemic. Today, there are 2,350 people in the hospital and 806 in the ICU at this time. In terms of testing, we did 54,246 tests processed yesterday, with a positivity rate of 7.8%, down from the day before. The current 7-day average of the percent positivity is 8.6%. With the variants, there are now 44,536 confirmed variants of concern in Ontario. The majority of these are the B1.1.7 variant, first identified in the United Kingdom. The 7-day rolling average positivity for the mutations or variants of concerns is 70.6%, which is slightly down than 73.6% 1 week ago. And that's the first trend direction we've seen of it coming down. So, what can we conclude? We're in this very precarious transition time. Are we at a plateau? Some things are plateauing. Some things are dipping down a bit. Our reproductive number, effective, has reduced from 1.2 down to 1.03. These are all indications that we might be starting to bend the curve a bit, but it's not enough time yet. We're just seeing the impact now of the stay-at-home order, and we need to watch it a bit further. On the other side, we've distributed over 4.2 million doses of the vaccine in Ontario. On Tuesday, we set a record on the number of doses administered in one day, 136,695 shots in arms, as people like to call it. And yesterday, we did 134,000 920 doses were administered. In the coming weeks, we anticipate receiving larger increases in the amount of Pfizer vaccine arriving in Ontario. This will mean more people immunized against COVID-19. This is the bright spot when we're having these hard times in the news of the hospitalizations and other cases. I'd like to thank everyone who got their shot or vaccination and all those who have registered to get their vaccination. All very important. I'd like to thank and acknowledge the many vaccination partners. And there are many, and that's what's really exciting. Many in hospitals, many in public health, many in pharmacies, many in community groups gathering together, volunteers, all levels coming together, and excited, as many say, it was a really good place to be involving at those vaccination sites. So we are really pleased that this is going well, and we hope to get more and more vaccine, to get more and more people vaccinated as soon as we can. And you've heard us say that we want to vaccinate ourselves out of the third wave. We'd like to vaccinate ourselves out of the pandemic as well. And we continue to work and drive at that at this time. So thank you for all who have already received their shot or vaccination, those who have registered, and those who are trying to sign up. Keep at it, keep working at it, and we'll do our best to get the vaccine out and around to the right places as we deal with different ideas and strategies that I know Dr. Huyer and the task force are working hard at this time. So we're doing all we can to get them vaccinated as safely as possible. And we also then, during this time, while we're waiting for all the vaccinations to get done, while we're waiting and we're seeing the fruits of some of your efforts already, I believe, if we're thinking we're going to start to bend the curve, that by staying home, by limiting your contact to your household, by wearing a mask when you're out in public places, good hand hygiene, staying home if you're ill, getting tested if you think you have been exposed or you're unsure, and checking that out. And keeping all those things in place. When you're out and around doing your outdoor activities, it's not meant for large congregate activities. It's meant for you to do with your family and that as much as you'd like to do out and around in those settings there. So if you're going to do things, do them carefully because you still need to follow the public health measures in those settings. And if we keep doing that, I'm hopeful that over the weekend we may see some further plateauing perhaps of our numbers that may indicate that we're starting to get ahead of some of these things in that, because the harder we do this, the better we bend the curve, the less people go to the hospital, the less that fill up our ICUs, and we can give relief to the hard-working first-line workers are doing their best, and our people in the hospital sector are doing all they can to mobilize, reassign staff, move people around to make sure that those who do get ill and need the care get it in the best way and the most timely way, because we want to make sure we keep those rates of healing and resolving down, and to keep our mortality rates down in that matter. So it's everybody doing their part, and together we can make that happen. Those are my comments. I'm going to see if Dr. Huyer wants to add some more comments before we go to the media.
Thanks, Dr. Williams. Good afternoon, everybody. As you've seen in prior conversations where Dr. Yaffe or Dr. Williams and I are together, I listen to the information that's provided by my colleagues, and I reflect on it. And today, I reflect a glimmer of hope that the numbers are a little bit less this week, but then I hear the 40 people who died, and I recognize from my other role that we have been seeing a number of people dying in the community outside of the hospital, which is new, unfortunate, and sad, because these people have not been able to obtain health care because the disease affected them so quickly and so seriously, leading to deaths in the community, which we did not see in the Office of the Chief Coroner in the first wave, as many people had been in a different setting. So I continue to reflect on the significant number of people in the intensive care unit, the incredibly hard and challenging work of those people to try to get better, their families to support them, despite the fact that sometimes the people who are sick have been transferred hundreds of kilometers to another setting so that they can receive intensive care unit care, and the tragedies that still occur despite that care. So numbers are still very high in the hospital. We're seeing the deaths. We are making a difference. And for that, I want to say thank you to those who are making all of those efforts to continue to do what they need to do from a work perspective, from a staying at home perspective, and all of the steps that people are taking while continuing to remember those that have suffered such tragic loss. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Dave Woodard with Global News Radio. Please go ahead.
Good afternoon, Dr. Williams. The Premier today said that it was yourself and the science table that recommended targeting outdoor activities like golf and basketball when it comes to limiting the mobility of people. But people on the advisory table have since come out to say that's not what was recommended at all. Can you set the record straight? Can you tell us if postponing outdoor activities like those activities like golf and basketball was something that you and the science table recommended?
Well, to be clear, the main thing that was recommended from my understanding from talking to Dr. Brown was that outdoor activities are safer than indoor activities. Nevertheless, one still has to maintain the proper protocols around our public health measures. That includes masking. That includes not congregating in large numbers, doing individual activity, except with your household, in that area there. So those are the main recommendations. The concerns were raised that people had complained that they saw large gatherings of people in outdoor parks and areas undertaking different things, including team sports and that with close contact without precautions. And that question was raised and they were made aware of that. So in general, our recommendations from my side and from the science table was that while outdoor activities are good, they should be maintained to be individual, household, family, not large gatherings with people close together without masking and without physical distancing. That still is the position that we had put forward there, but I know that a number of people had raised concerns to various individuals that they felt there was a lack of adherence to that by various groups around the province and that, so they're aware of that. So those were the recommendations that we made.
And just to build off that, I think one of the key recommendations that flowed from the public, as I understand, because I wasn't at either of these tables, the public health measures table and the science table, was to focus on mobility and to reduce mobility and to maintain to limit the intersection with others, to limit the movement of people across jurisdictions, sometimes across different locations within the jurisdiction that you're in, to reduce the potential for transmission, the potential for spread, the potential for infection, and therefore hospitalization and death.
Follow-up?
Thank you. Perhaps I'll be a little more specific, Dr. Williams. If you were asked point blank from the Premier whether you think that sports like golf or tennis should be banned or, I guess, postponed for the time being, what would your advice be?
The advice has been always that if you're going to undertake to do those kind of things, can you guarantee that you're doing them, as Dr. Huyer's alluded to, have you decreased your mobility, not travel all over the place for it? When you're undertaking it, can you keep your 6-foot distance all the time, except with your household members? And can you guarantee that in the action you're undertaking? We had reports from people who were sharing very close proximity to each other, whether it's in golfing or in other things. And so there's a desire to try and be consistent because one thing that was very concerning and that was made clear by the science table is that without strong measures, and they were clear on that, if you had to do certain things, if you didn't make sure they were strong and consistent across the board, we will not be able to bend the curve. And the numbers that were projected, both in hospitalization, ICU, and et cetera, was very daunting and I think very shocking to everyone, and need to see how to best do that because everybody wants to bring those numbers down, do all you can in a very concerted effort in that time, and they took those projections very seriously.
I think One of the other things to remember as well is how do you get to those activities? And certainly there's the activity itself. It's then getting to the activity. And so people might have shared vehicles and vehicles being in close contact, obviously, without necessarily as much, a greater chance potentially of transmission. So thinking about the getting there, the activities that occur when you're at a setting, and then what are the activities to leave from there. So I think it's really thinking about the broad picture where mobility, again, becomes one of the key fundamental factors to think about in ensuring that we reduce our mobility, reduce our movement, and therefore limit our intersections with others, except for those where they may need to for a variety of reasons, or if there's a particular family member or friend that they would be associating with.
Next question.
Your next question comes from Colin DeMello with CTV News. Please go ahead.
Hi, good afternoon, Dr. Williams. You're asking hospitals to stop non-emergency surgery. We're just trying to determine what emergency surgery would still be allowed. What do you define as emergency surgery, and who at the hospital would actually make that determination?
Well, that's why the directive, which was basically a continuation of what the memo was put out by Ontario Health, it does lay out in there very clearly that is the decision of the physician and the presiding specialist at that time. They know what our emergency surgeries are. They can move some things that might have seemed in some areas at times elective to semi-elective to urgent if they feel it's necessary, depending on the course and situation there. So having done that before, they were very, I think, diligent at following those recommendations. They know that what's best for the patient, if they need to move it towards surgery and it has to be done, they will do so. So that leaves it totally up to them and their responsibility, because they are the caregiver and they are the specialists who can assess that situation and can understand what is necessary, what is urgent, and what is semi-urgent, and what is elective. They're the best judges of that.
Follow up.
Thank you. Earlier this week, you were talking about the closure of non-essential workplaces, and it seemed like you were still kind of on the fence in terms of what should close or what should not close, and where we were going to go with that. Have you landed on whether non-essential businesses or workplaces should be closed, and is there a list that's coming soon or a decision that's going to be made soon above and beyond what Toronto and Peel have already done?
So I think what we're trying to do here overall is we're trying to, and I think same with Toronto and Peel, we're trying to look at the workplace essential. The ones that are open right now are supposed to be essential. As I said before, there's a lot of things that at first blush you'd say it's not essential, but then you find out from someone's perspective, they depend heavily on that. Is there other way to get it, yes or no? And you may say, well, it is, but those of with less, I would say, affluence and ability can't get it. And so it may actually marginalize that even further. But I think what we're trying to do there is to say if you have cases in a workplace, if there are cases there, is it transmitting in the workplace? How do you protect those workers that are on that? Already the Ministry of Labour has been in with recommendations. They've given out many notices and orders. They've done some actually restrictions and aspects there. We would like more of that undertaken, and they said they're going to look at aspects how to do that. At the same time, we would really like to get those ones vaccinated if we could, and we're trying to understand how we might do that in our hotspots especially. And I think that is consistent with what we're hearing from our experts recommending to us. You know, Dr. Huyer and the team with the vaccine task force are seized at looking at that and how one might undertake that to ensure that the workers get the best protection they can, because they're the ones that sometimes are putting the stuff together, that the food on the table and other things that are in the public's mind is very essential and critical. But they should not do it in such a way that their health is compromised, they or and their families. So we're trying to look at how to do that in a comprehensive way to not only just have them closed, but how do we get them protected and make sure they stay healthy on the job and off the job.
Next question.
Your next question comes from Randy Rath with CHCH-TV. Please go ahead.
Yeah, hi. Thanks for taking my question. Dr. Huyer, if you could explain a little bit more about these deaths in the community that you say you find very concerning. What variant of concern is causing these deaths? How long is it taking from the onset of the disease to death? If you could just give us some more information on that, please.
I don't have a comprehensive review of all of those at this point. We're still trying to understand and evaluate. What I can tell you is the numbers have been certainly elevated in the range of approximately 2 per day over the past 2 weeks. And that is in excess of anything that we saw during Wave 1 and over Wave 2 as well. We are seeing them in a range of ages from a younger age in their 30s up through into their 70s. And many have either had a test positive or are associated with people who were test positive, and that they have had symptoms, and then those symptoms have been present, not to the extent that were recognized as necessarily requiring hospitalization, and then they were found deceased later in the day or in the morning. And so we are still evaluating and trying to understand all of the circumstances, but certainly it's notable in the fact that this is a younger population, this is a population in the community, this is a population who are suffering serious consequences in the form of death in a quicker period of time that we saw in the past.
Follow-up?
How can we guard against that? Does this mean that there's going to be a different protocol when people get sick? Should they? Is there anything we could do to try and prevent this sort of thing from happening in the community?
Yeah, strict and careful and thoughtful following of public health measures and reducing transmission and ensuring that we do everything that we can to reduce the spread of this virus. We're taking those steps. We're working together to try to do this, and everybody that can are taking all of the steps possible. There are some that are required to do additional activities in their day-to-day work and their day-to-day placement. But it's really important that we all think about the risk of putting each other and others and ourselves into in all of the activities that we do. Reducing our mobility, staying at home, staying safe, and saving lives is the approach to take.
Next question.
Your next question comes from Jack Hahn with Queen's Park Briefing. Please go ahead.
Hi, Doctor. Does it make sense to you that overnight camping isn't allowed? Wouldn't that fit in the good outdoor activity section of if you're only doing it with your own household?
We've looked at that, and one of the aspects of those who have done that, I've done that before, is that when you're in those settings there, one of the challenges we've had to look at is that when you're doing the camping, you have to use the congregate use of the washrooms and facilities and showers, that they're not set up for individual use, whereas we've allowed individuals who have need to have residents that are of contracts with some of the parks that they can do so because they usually have self-contained units and can do that, and they need a place to reside, and we've allowed that. But where in the spring sometimes you often get, and we've experienced that sometimes with large groups gathering, big parties and stuff, sometimes they've had to be removed from the camp. So it is another chance for more mobility, more traveling, more moving around, which we're trying not to encourage at this time, so we can get towards perhaps a better summer. But we have not opened that up at this time because of the need for congregate type activities that one has to have when one is undertaking doing that in campgrounds and in the provincial parks.
I think if I reflect on the question that Randy asked that we just provided answer to, and think about what Dr. Williams said, what do we do in trying to figure out when somebody might be unwell? Well, unfortunately, as we've come to learn with this pandemic, and we've learned so many different things about the virus. I've learned so much from Dr. Williams and Dr. Yaffe and many other public health unit experts who I've had the honor to work with, who have been working so hard over this period of time, and everybody in the hospitals as well. We've learned that asymptomatic people, or people don't recognize the symptoms, especially those in the younger set, may have the virus and not recognize that. And so again, speaking about mobility, and so going to those camp facilities, not so much about the individual family in their particular camp area. It's the intersections that they may make, not recognizing that they may be ill and that they may be transmitting from one area of the province to another. And so it's really thinking about, again, and we've said it a number of times today, mobility and the potential for transmission and reducing that potential in whatever way we can to allow to stop this virus from transmitting from one person to another, because it really lives from one person to another. And it's any way that we can stop that, whatever ways we can, is what we need to do.
Follow up?
And I was also just wondering, Dr. Williams, as a doctor, what's it been like for you to watch these frontline medical workers really savage the decisions that this government has made over the past little while? It says that they thought about quitting, yelling at the TV while the Premier's talking. Can you empathize with that at all?
Well, having been in the past in hospital practice, not right at this time, the stress and tensions are immense. And it's one thing if it's for a period of time, like a few hours. If it goes into longer hours, it goes into extended hours, it goes day after day. It goes into not a 4-day week with 12-hour shifts. It goes into 5 days, 7-day. It gets exhausting and it becomes very emotionally traumatizing, especially seeing more and more very younger people coming in. And this is really disturbing, and everybody gets very frustrated. We just like to just make it end. And we would all like to make it end in there. And that's why we're working hard to see what other resources we can put in to assist them in that, to try and alleviate the other aspects of the workload as best as possible, knowing that there's a backlog if we cancel elective surgeries. At the same time, it frees up more staff to assist, to give those people a break, to try and help them, because it's not going to go away as they see it in the next day or so. They only see it getting bigger each day. And of course, I can understand and sympathize with their frustration. And it's been not only this wave, they did that in the second wave, and some were very much involved in the first wave. So this has been going on for a full year, now a year and a half. And people are getting tired, people are getting worn out, people are getting frustrated and perplexed in the whole situation. We had hoped that the vaccine would have been out sooner, and we got a number of delays that would have given some alleviation. At least we're working hard to get our healthcare workers vaccinated, because that was a major area of stress for many. We'd still like to continue that process to complete it, but we're trying to do whatever we can to try and ease off that tension and pressure. That we thank all the ones that are stepping up again and again and again to do not only what they believe in, but they have a great passion for and a great compassion for their patients and for each other in this fight against the pandemic. So I can understand that frustration, and I've felt that at different times myself. In there, when you're involved in that, in the heat of the action, when the heat just continues and continues and continues. And that's challenging, and that's why we want everyone, because it's all our part to relieve that load. If people are doing everything they need to do, then there's no cases. It's communicable. That's what it is. It passes from person to person. If everybody was very careful with that and we drop the numbers down, the ICU cases go down. The pressure goes down on the healthcare system. The pressure goes down on these people who are very frustrated and can't see and say, not another one and another one and another one. Sometimes 2 or 3 new ones every shift. That is a huge frustration and very demoralizing to the staff to see that. We have to, as a community, we have to have, as Ontarians, pull hard together right now to bring this down. Why we get vaccinated? Well, the vaccine takes time to take effect. It doesn't happen instantaneously. So we all have to do our part in this, because while they have the frustration of dealing with it, we have the challenge to bring it down and whatever we can on the outside. So we're all in that. I know the public are saying, here we go, another wave. We're getting tired. We're getting fatigued. But now's not the time to give way on that and to just be casual. Now's the time to really focus, because I said there's some indications that we're turning. Some. I'd like to see that really evidenced in the next 2 weeks. So we got to do our part to help them as best we can.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, doctors. Like Randy, I would like to dig in a bit more to this, the problem with people dying at home. I'm assuming these their families are calling ambulance or something like that. But is the main problem here that people aren't recognizing symptoms are serious enough soon enough? How did we get here, and were there any of these cases in the previous two waves, or is this only something we're seeing now?
Rob, thanks for the question. I mean, getting as granular as that is difficult because these are all cases that are just coming to our attention now. It's something that I felt was important for people to understand the seriousness of what we're dealing with. And these are not people that ambulances have been called because they've been deteriorating. Many of these people were found deceased. The symptoms, when I've read through the information of the significance of the symptoms, these were people that weren't necessarily appearing based upon their symptoms to be needing to go to hospital or an ambulance to be called. So it's not that people were ignoring symptoms from what I've read in them. I need to drill down a little bit deeper, but these are people who did have stable condition and then deteriorated very quickly to their unfortunate deaths. So I think it amplifies and recognizes the importance of what we need to do to ensure that we reduce the potential for people having infections. I go back to what Dr. Williams was answering, the difficulty of the healthcare system. We want to ensure that everybody's provided the best opportunity to not have to suffer and not have to enter into the healthcare system.
Follow-up, and this is the last question.
Thanks for that, Dr. Huyer. And one for Dr. Williams. Just looking at the last couple months or so, I know you thought, and because I've asked about this before, and you've answered that you thought it was justified at this time. But in retrospect, now, was it a bad idea mid-March-ish to loosen the restrictions on indoor dining outside the lockdown zones and loosen some other restrictions, and then a week later open the patios in a lockdown zone? Is that what caused things to cases and variants to ramp up, or was it something else, perhaps?
I think, one thing we've learned is that as we saw the variants coming in January or in December, some of the projections, even as we learned more and more about the rapidity of spread, we found out more about how it affects the higher rate of hospitalization, higher rate of ICU admission, higher rate of deaths, and earlier onset of signs and symptoms. In March, when we were looking at some aspects there coming out of the second wave, there was a sense that the public were looking for some changes. We took the recommendations that with the outdoor dining, that outdoor was safe and we could do outdoor if people would follow the rules and recommendations. Indoor was with household, if you remember, and that's with only 4 to a table in different settings. So we still had a sense that household was safe in that area there, saying to the public, if we give you this kind of latitude, will you adhere to the other ones? Will you continue to mask? Will you continue to distance? Will you stay with your household and that? And unfortunately, that didn't occur. We saw many examples of crowding in some of the outdoor settings. And again, that was challenging, and we had to come back down and restrict it yet again. So that was disappointing. Was that the only source? As we saw from the modelers, they were saying the way it moves and the way it's progressed in other countries, unless something is done in some areas there, we're going to see record numbers of 9,000 cases a day in there, unless you do something. And so we brought back in, we started moving people more into the higher zones as their numbers accrued, and we limited again and again, and finally got down to the emergency break. Then we went to the stay-at-home order. So we keep on layering on more and more in there. The key is, if you're going to have strong public health measures, it's how strong do people adhere to them? And that's the critical part. And that's where we really need to have the public pulling together hard this time to do that and to make sure that we can do that. We can say all we want, but if people do not follow, if people ignore, and if people decide to be casual about it, there's a big mistake. And in the first and second wave, some age groups said, it's not really a big deal for us. As Dr. Huyer's been alluding to, and he's trying to say, now in this third wave, with our older age groups vaccinated as it's moving down, there are younger people that maybe they thought it was a benign issue before. It's not a benign issue. And many of our frontline healthcare workers are saying there's younger people coming into the emergency department not just feeling well, they're coming in critical condition already. And so this third wave, these new variants, it's a whole new picture, a whole new scene. That's why everybody has to pull together. And that's why some of those measures, while they might have made some difference, I don't think they make a lot of difference if people don't adhere to the public health measures, if people do not take precautions, if they do not mask and distance, all those things. If you do not follow those measures, they become weak and they don't have strength in it. It's the strength, it's what is we as people, what is we as citizens, knowing with each other, how we respect each other, care for each other, and we care for those frontline workers in the hospital setting, and to stop that flow of patients in there. We can do it. It's not meaning you have to do it forever. We're continuing to drive out the vaccines. We're continuing to get people vaccinated. We're trying to do it as fast as we can, supply permitting, and trying to get to the best places as quickly as we can with the most we can to try and bring this under control. So it's a race against time, but that means hold tight, do what you need to do. We can see some evidence it might be slowing. I said some evidence. I haven't got real proof of that yet. I want to be able to tell you more next week. And this is what the fruits of your actions are, your consistent handling of this personally, family-wise, and community together, pulling together to do the best we can to keep those institutions, such as our hospitals, and we hope someday our schools open again, because we have to do our part all the time, every time. So take care and be healthy and keep each other healthy.
Thanks, everyone.